I thought health was a universal right. Why do I have to pay out of pocket to get access to healthcare in Australia? What is bulk billing and why doesn't my GP bulk bill me? Good day, I'm Dr. Tia, and today we're talking Medicare, the first in a series to explain Medicare to the Australian population. Hope you can join me. So let's get started. What is Medicare? Medicare was established as Medibank in 1975. It is a universal health insurance of sorts that covers Australian citizens, permanent residents, and visitors from countries that offer reciprocal health care. Medicare is basically Australian government saying, hey, you pay tax, and as a result of your tax, we're going to take some of that money and put it towards your health care. We will cover some part of your care if you are attending a GP consultation, a specialist consultation, if you are needing to buy medication. It is technically an arrangement between the government and its population. The government and the Australian citizen, the permanent resident, and visitors from reciprocal healthcare countries. So, the Australian government sets a value that says, I as Australian government believe this service, let's say a 20-minute consultation, which is the most common, should cost $40. They established that as the amount the Australian government is happy to subsidize care for. It is currently about $43, $44. That's how much the Australian government says if you go to access healthcare and you spend 20 minutes with a GP, we are happy to give you a subsidy for $44. Now, the problem becomes when the Australian government also wants to make the budget looks nice. It tends to then stop the inflationary increases to Medicare that are necessary for those service fees to keep up to par with the cost of providing the service. And it says, no, hold up, we're going to have 5-10 years of just freezing this Medicare rebate to you, the patient. Now, unfortunately, the costs to provide the service still go up. Year on year, inflation, bills, paying nursing staff, etc. So when you go and see a doctor who says, I'm a bulk billing doctor, that doctor is saying whatever the Australian government deems as an appropriate fee for the service that I'm providing, that's all I'll take. And so when you go into a bulk billing clinic, technically the Australian government says, I'll give you $44 for seeing that doctor for 20 minutes. And that doctor says, for 20 minutes, I'm charging you $44. So the money goes from the government to you to the doctor. It happens so quick that you don't actually recognize that it was the government paying you as the patient to access care and to pay for the service you got from the doctor. Now, when you attend a private billing GP clinic, that doctor is saying, actually, the cost to provide this service has long exceeded the amount of money the Australian government is happy to subsidize the service for. So you work in a clinic and they say, actually, the cost to see a doctor for 20 minutes is $100. What that means is that the Australian government will only still subsidize you $44 and then you are out of pocket the rest of the cost to access that service. But it's still the same. You go in and you tap your card for $100. The Australian government then still gives you the $44 that it has sworn to pay you when you access a consultation for 20 minutes with a GP. So if there's ever any questions about the price of access of healthcare and why prices are going up, they actually are not much to do with the doctor, because the doctor is saying the cost to provide this service has over the years continuously been going up. And so the entity that people should get upset with is the Australian government, because the Australian government has in itself stopped the inflationary rise of the rebate to provide the service that you are currently requiring. which is why then you are out of pocket. I hope that makes sense, and I hope to see you in episode 2, Explaining Medicare. Till next time, bye.